This segment of DelmarvaLife is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Do you ever stop and think about your feet? I mean, if you think about it, they're the unsung heroes of your body. They hold the body upright. They get you to wherever you need to be. They really do quite a lot.
Yeah, and I do actually think about my feet, Corey, and I have to admit I don't always give them the love they deserve, and I'm especially hard on them in the summertime. But apparently I'm not alone. Although foot problems can happen all year long, summertime can be a tough time for your feet. So say the folks at Thomas Podiatry and Associates.
It seems like every year, summers are getting longer and hotter. And while that might be good for your social life, it can increase the risk for foot problems.
We see different problems, definitely problems related to more activity.
Dr. John Thomas of Thomas Podiatry and Associates sees those problems every year when the temperatures begin to rise.
It's getting warmer, so people are out walking more, trying to lose weight, get in shape, and they haven't done much over the winter, and so things start to hurt a lot of times.
For a lot of people, that pain may be in the heel of the foot.
Most commonly, the heel pain is something called plantar fasciitis, and that's inflammation of the plantar fascia, which is a strong tendon-like structure that goes from the heel bone out to all 5 toes. But typically it's due from a tight calf muscle, and that causes it to be overworked. And so when people aren't moving around, things tighten up, and then when they start being active again, that's when the symptoms show up.
Dr. Thomas recommends stretching or yoga to prevent the problems, but sometimes supportive shoe gear is needed. Although sports injuries happen all year long, Dr. Thomas says they tend to pick up in the summertime.
Backyard, a lot of people will fall in holes, twist their ankle, sometimes get fractures. So you see a lot of that, or people doing home improvement projects.
Dr. Thomas says depending on the severity of the injury, you may need to get it checked out. And if you're a diabetic, just about all foot problems should be considered severe, especially this time of year.
But in the summertime, we start to see more ulcers and pre-ulcerative calluses, which can both lead to amputation, so they're important to treat right away.
But Dr. Thomas adds that risk should not stop diabetic patients from getting out and getting exercise. They just need to be protected.
There's special diabetic inserts that will reduce the formation of calluses. Sometimes you just need to be seen earlier to have the calluses trimmed as they're developing. And in the case that something opens and turns into a sore or an ulcer, that needs to be treated right away.
Perhaps the biggest risk people take in the summertime, according to Dr. Thomas, is wearing shoes that don't properly protect your feet from problems. Shoes such as flimsy flip-flops.
You really need to check the sole. You need something that doesn't bend too easy. When you have something that's flimsy and not giving you the support, it overworks the tendons and joints. So if there's any arthritis or weak tendons, unhealthy tendons, they would show up then.
Dr. Thomas says, bottom line, pay attention to your feet no matter what time of year it is.
Good shoes, check your feet. If you see anything going on, rashes, sores, they need to be looked at. But yeah, good hygiene, good supportive shoes, not increasing your activity too fast just because the weather's nice. If you stopped last summer running 3 miles, you can't start back up running 3 miles. You need to start back at a mile and work your way back up.
And Dr. Thomas says there are good flip-flops and sandals out there, but you'll probably have to pay more than a couple of dollars for them.